Okay, first of all, we will discuss about diagnostic applications. Current diagnostic method, as you all know, that for most of diseases depend upon manifestation of some visible symptoms before any medical professionals who can recognize that patient suffers from a specific illness. But by that time, those symptoms have appeared, treatment may have a decreased chance of being effective. So, earlier disease can be detected, the better chance for a cure is. So, nucleic acid diagnosis and polymerase chain reaction (PCR) leads towards such tests and devices, but nanotechnology is basically expanding the options currently available, which will result in greater sensitivity and far better efficiency and economy. So, in first of all, diagnostic applications, first of all is detection. Many currently used and conventional clinical tests reveal the presence of a molecular or a disease causing organism by detecting the binding of specific antibodies to the disease related targets. So, nanotechnology basically offers a solution by using semiconductors, nanocrystals, also referred to as quantum dots. These minuscule probes can withstand significantly more cycles of excitations and light emissions than typical organic molecules, which more readily decompose. So, another diagnostic application is individual target probe. Despite the advantage of magnetic detections, optical and colorimetric detections will continue to be chosen by medical community. Nanosphere Northbook Illusions is one of the companies that developed the techniques that allow or allowing detectors to optically detect the genetic compositions of biological specimens. Another diagnostic application is using protein chips. Proteins basically play a central role in establishment of the biological phenotypes of organisms in healthy and disease states, and are more indicative of functionality. Two companies which are currently operating in this applications space are Agilent Inc. and Nano Inc. Agilent uses the non-contact inkjet technology to produce microarrays by printing oligos, and while those of the cDNA onto the glass slides at the nano scale. Another diagnostic application is the sparse cell detection. Sparse cells are both rare and physiologically distinct from their surrounding cells in normal physiological conditions. For example, cancer cells, lymphocytes, fetal cells, and HIV-infected T cells. These are significant in the detection and diagnosis of various genetic defects. Nanobiotechnology basically presents new opportunities for advancement in this area. Scientists develop nanosystems which are capable of effectively sorting sparse cells from blood and other tissues. This technology basically takes advantage of or exploits the unique properties of sparse cells manifested in differences in deformation, surface charge, and affinity for specific receptors and or ligands. Another diagnostic application of nanobiotechnology is as a tool in imaging. Intracellular imaging can be made possible through the labeling of targeted molecules with quantum dots or synthetic chromosomes such as fluorescent proteins that will facilitate direct investigation of intracellular signaling complex by optical techniques, for example, the confocal fluorescence microarray or correlation imaging, etc.